Well, hello, everybody. We're so excited to be here today and to start our conversation with Dr. Taiwo Alonge on equity in mental health, issues facing BIPOC teens, and his work with BeMe. Today, we're going to dive into the mental health of teens who identify as male, non-binary, or gender non-conforming. Dr. Taiwo Alonge is a second-year psychiatry resident at Yale. Prior to starting work as a resident at Yale, he received his MD from Columbia University and a master's in public health with a specific focus on health policy and management. His interests are in mental health care, innovation, and policy for people across the lifespan, with a special focus on kids, teens, and young adults. He's also passionate about health equity and ensuring that health disparities affecting some of the most vulnerable populations are addressed, namely for BIPOC youth and people minoritized by their gender or their sexuality. Although he's early in his professional career, he's already begun to engage in this health equity work in clinical practice, in working with community organizations in New York City and in New Haven, in engaging in mental health care policy advocacy with the American Psychiatric Association, and most recently in working with us here at BeMe. In January, Dr. Alonge began working with us at BeMe as a clinical innovation fellow, and in his role, he's really helping make sure that BeMe continues to be as inclusive and equitable an experience possible for all teens, no matter their backgrounds or their identities. Taiwo, so happy to have you here today. Anything you'd like to share about your background, your interests outside of your professional work? We'd love to hear it.
Thanks so much for the introduction. I think that covers just about everything. I mean, it's really such a pleasure and a privilege to be able to help take care of kids, as well as just being able to think about what this work means for people across the lifespan, and particularly for minoritized youth. You know, in terms of my interests, and I'll talk about this a little bit more. I love sports. I love music. I love culture. I think they really impact our mental health. I think mental health is really everything, which is what made me want to come into this field. I'm excited to be here and to talk with you all.
What sports and what music? And then I'll let you off the hook.
Yeah, I love basketball, and I also love rap and R&B and electronic music. I like all music, every single genre.
That's awesome. Well, what an impressive background, Taiwo. Again, so happy you're here with us today. There's clearly a lot to talk about. So let's talk.
We like to start our BeingMe podcasts by asking you to tell us a little bit about teenage Taiwo. Did you have a nickname? Were you confident? Were you shy? Did you participate in school activities, sports, debate? I know you mentioned sports already. What was teen Taiwo like?
I think I had it pretty good overall. I mean, I was born and raised in Miami, Florida. Both of my parents immigrated to the US from Nigeria. And kind of unlike a lot of their peers, were pretty relaxed and not that strict. Teen Taiwo, or Wo as my friends called me. I feel like I was into so many things. I think my foundational pillars, like I said, were music, sports, and culture. Love rap music, love R&B, love the NBA, particularly the Miami Heat. That's my team. Grew up watching Dwayne Wade and Shaq, and saw LeBron and Chris Bosh come down. And now we have Jimmy Butler, and it's just a really awesome show. I actually played basketball in high school. I'm super tall. I'm 6'7". I think I was about 6'5" when I graduated high school. You know, it was pretty good, but didn't really get to live out my hoop dreams past high school. People still give me a hard time about that today and ask me, why am I a doctor? Because I'm so tall. We get a good laugh out of that. I also worked in my school's newspaper. And as well, in terms of my confidence and being shy, I think I was both sometimes, situationally dependent. I got in trouble a lot at school sometimes for talking too much. And then sometimes I was a kid that kind of sat in the back and really just listened and offered the analytical and deep perspective. I had a lot of opinions and still do to this day.
Some things never change. No, it's amazing what you just shared. You could be a 6'7" basketball player and still have days where you're feeling a little bit shy or a little bit less confident. And it really goes to show that you never know how somebody's feeling on the inside. And even for people who feel like they're doing well or in a good headspace or feeling more confident, that's not going to persist every moment of every day, right? So I appreciate your sharing that. So as I mentioned in the intro, you are a psychiatry resident at Yale. Can you share a little bit more about your medical career journey? I mean, what led you to medicine? What led you to pursuing a career in psychiatry? And then what additional work or research are you focused on? And what really got you interested or motivated in doing that work?
There's a lot of things that brought me to medicine. I mean, from the jump, it was really learning about my older sister who was born in Nigeria, producing low thyroid hormone, and kind of being able to see the impacts that had on her, particularly causing her to have some cognitive developmental delay disabilities. And learning about that as a kid and seeing really that where she was born pretty much determined a lot about her health and her life, and then kind of seeing that reflected in a lot of my friends growing up in Miami, seeing that reflected in a lot of the people I got to volunteer with at camps as a kid, and then even in college when I worked in pediatric hospitals, and kind of seeing that story over and over again. And that really drew me to medicine. Initially thought I'd be a pediatrician or a family doctor, and I was like pretty much set on that. And then kind of got a little bit sidetracked in medical school thinking about becoming a surgeon. Initially wanted to be a cardiac surgeon for kids. Then the lifestyle and the hours and hours in the OR kind of scared me away. So I like jumped down a little bit to pediatric ortho, particularly working with sports. But then again, it was still lots of hours. I even actually applied. I applied to like 70 programs, did 4 away rotations. I was really locked in, but those long days, early mornings, late nights, I kept thinking about my pediatric psychiatry experience, particularly working with adolescents in New York City, and got to work with some Black teenagers in New York, actually. And really being able to be there and have conversations around mental health, them even telling me about how they've never really seen someone like themselves in that position, and being able to feel vulnerable and demonstrating that in some ways as well was really big for me. Eventually coming to Yale, a lot of the work that I began to do in New Haven was really working with community organizations that work with kids. So again, helping build mental health literacy, talking about mental health with teenagers, kind of understanding their perspectives, thinking about what things we can do for the school board, because I'm working with the school board as well. And just really kind of beginning to think about mental health really collectively and thinking what we can do at the individual level, but also at a bigger structural level as well. So it's been really awesome and super exciting.
How do teens conceptualize and understand the term mental health, and what do they see included in that framework? Also, how can we better support young people in developing a more nuanced and comprehensive understanding of mental health, including the many different factors that can impact their emotional well-being?
Yeah, I think that's a really interesting question, because I think today teens understand mental health much more clearly than teens that came before them. But that's just to say, awareness now is important. But however, we know awareness doesn't necessarily mean that things are better from a mental health standpoint. As the data shows, it's a really challenging time in our country for young people in terms of mental health. But again, there's awareness in social media, popular music, TV, movies, even in school curriculums across the country. But to answer your question, I think to varying degrees, of course, teens understand mental health as instrumental to their health and daily lives in general, whether they're aware of it or unaware of it. So in conversations I've had through the BeMe tab or Teen Advisory Board, or even in conversations I've had with teens here in New Haven, really we have all kinds of conversations when we bring up mental health. We think about relationships, we think about things that they like to do, whether it's sports, exercising, fashion, arts, really just kind of the whole collective experience for them really reflects mental health. And I think teens are also really passionate about talking about their well-being in ways that I know I wasn't when I was a teenager. And I think that's really awesome. Again, because we're seeing so much struggle with respect to mental health, despite this increased awareness, part of the work that we need to do as mental health professionals and advocates is to think about how to support teens and allowing space for their feelings, but also trying our best to make sure the spaces are welcoming, safe, nurturing, and more. We have opportunities to be in these spaces that can shape the environments that these kids find themselves in, whether we work in clinics, hospitals, whether we are part of school boards or helping write policy. We have that ability to really support our young people, and we need to do that. And I think that's where we start.
Definitely. I think that's really, really beautifully put. Let's talk about teens who identify as male and their emotions for a moment. Most boys are taught that, quote unquote, boys don't cry, or when something upsets them, they're often told, quote unquote, man up or something along those lines. How do you feel like this messaging affects boys as they grow up?
This actually came up in a recent focus group where we talked about that specifically, and some of the teens even directly quoted, boys don't cry. And, I think overall, teens today are doing a little bit better with respect to that than teens in the past, but nonetheless, we still have a long way to go to really get away from these harmful tropes. Messaging like this can be so damaging with teenage boys and male-presenting teens because, like we said before, it just doesn't really allow them to have a space for their sad or angry feelings or even negative feelings. It really just allows them to stay bottled up. It festers, it grows, it has long-term negative implications for them as they grow into men and into adults with their relationships, their ability to relate to people, and also creates feelings of isolation and loneliness. We understand that feelings, good, bad, neutral, are ways that we connect with people and grow deeper relationships. And when boys are told not to express their feelings or not to feel sad, or that feeling sad is a weakness or having feelings is a weakness, it's in turn teaching them to not be able to connect and further isolating them, causing a lot of loneliness and deepening internalized self-suffering. Add specifically for non-binary and gender non-conforming youth, these dynamics are so layered and for reasons that are not of their own doing, but rather just from the negative messaging and lack of inclusivity that society has, sometimes intentionally and sometimes unintentionally, that reinforce. Yeah. So we need to pay special attention in these circumstances.
What are some ways that boys can reclaim their emotions and change the expectations of how society expects boys to release these feelings in a healthy way? And how are you seeing Gen Z reframing these types of messages?
I think I'm really seeing Gen Z really do a great job in reframing these type of messages. And I think in some ways, like the popular media has been a really good space for this. Again, I think I recently saw a clip of like Michael B. Jordan and Jonathan Majors, who were the two lead actors in Creed, talking about their friendship off the set and just using words about like loving each other and being friends and even asking each other to be friends. And I think that's something, that kind of representation is not seen. And it's like such a pleasure that the youth are getting that today.
That's awesome.
But moreover, I think just really encouraging teens to express themselves. Ideally, home is a great space to do that, but that's not always the case for people. Some people don't necessarily have people in their homes that might offer a safe space for them to express their feelings. And that actually came up in our focus group last week. I think teens hopefully are able to identify trusted friends, family members, adults that can be really important spaces for them to be able to express themselves. I think about schools, I think about coaches, I think about faith communities sometimes being spaces that work as good alternatives for people if self-expression of feelings is not really allowed at home or even really accepted. Last, I think mental health professionals are also key as boys and male presenting individuals understand that, in helping them understand that seeking help is not a weakness, it's actually a strength. I think this messaging is applicable to all boys, but specifically for communities of color. And speaking from my own experiences as someone who was once a Black boy and I guess now a Black man, knowing how challenging it can be to find these spaces because you find yourself often in spaces that don't welcome you, let alone your feelings. So we need to really be paying special attention to these communities that have been marginalized, who are vulnerable, and thinking about how to intentionally create these spaces. And I think, again, Gen Z has been doing a really good job from what I'm seeing in terms of creating these spaces. I'm seeing it again in music, like Kendrick Lamar's album recently had so much about his feelings and his emotions and his hardships, and was such a vulnerable space that I think is really encouraging. I think, again, about like different organizations and groups. In the organizations I'm working with in New Haven and the ones I worked in when I lived in New York City, there were spaces really focusing on teenage boys and thinking about talking about emotions and saying that, being strong is not holding your emotions in, it's keeping them and letting people know how you're feeling and being able to communicate them. So I think that's really encouraging.
Can you speak to the challenges and unique barriers that boys face when seeking support for their mental health? And how can we better support boys and those who identify as male or non-binary in recognizing and addressing their struggles before they reach a crisis point?
I think the crisis point is the key phrase there. A big challenge boys and male presenting youth face is the fact that their presentation of mental problems, really at all levels, tend to reveal themselves at later stages or even at crisis. And I think the last question we asked about boys don't cry or man up really plays into that, because in so many ways we've socialized boys and the top boys to not express their feelings. And again, they let those feelings fester. And when they finally present, it's a crisis point. The data shows us about suicidal ideation being lower in boys compared to girls. However, the rates of completed suicide or the lethality of suicide is a lot higher or more severe in boys. And I think this also plays into that. So as trusted loved ones, again, mental health providers and advocates, we need to be thinking as much as possible about how we can be proactive in talking to boys about their feelings and creating these spaces. We want to prevent crisis as much as possible, and that will really require all hands on deck.
Absolutely. I want to come back to something that you just said, where you noted that the rates of completed suicide differed by gender. And I just wanted to go a little deeper on this idea of health disparities and also systemic biases that impact diagnoses and outcomes, especially for teens of color compared to their white teens. What disparities have you seen? What do you know of from your research? And then what do you think can be done to address those disparities?
There's so many disparities, and it's really layered throughout history and present day. I mean, for starters, there's real harm that the healthcare system and mental health care system has done to BIPOC people historically and even presently. When we think about that and how that creates dignified hesitancy for people to even come to these systems that are supposed to provide care. It's worth noting scholars such as Harriet Washington and Dorothy Robertson, who provide, again, ample examples of this. Mental health specifically, though, there are practices in which Black people specifically and other people of color sometimes get diagnosed with psychotic disorders or manic disorders that they wouldn't get otherwise if they were white, such as getting diagnoses such as mood disorders and things of that nature. And that usually results in getting the wrong treatment, but even more importantly and more scarily, that treatment is not benign and it often can actually have negative consequences because it's one, not treating the right thing, but then they're getting higher doses of medication with side effects and just really goes down a negative spiral. For BIPOC boys specifically, again, there's ample literature about boys not being diagnosed with ADHD, anxiety, or depression, and instead being given conduct disorders or other disorders that are not fitting the proper bucket. And we don't really see this with their white peers. And again, these are boys who are now missing out on opportunities to get the proper treatment they need for what they're going through. And that's a really scary disparity that we're seeing with respect to mental health. Ways to address this, there's not a one clean, simple solution, but there's several that we can begin to do. I think about representation. Certainly it's not everything, but it's actually really important in trying to help reduce some of the biases and having people who have cultural similarities to the communities they're taking care of to better understand what's being presented in the clinic and health settings. But I think even more importantly, it's thinking about our systems and practices to then again, better neutralize the individual biases that we all have, because we all have biases, particularly against BIPOC people, unfortunately, because of the society we've been socialized in. So again, if that's thinking about how we diagnose people, if that's thinking about what resources are available, and if that's thinking about the larger determinants of poor mental health, that's how we have to start to address these problems so we can really achieve health equity.
It's a really good point. I'm wondering if you can give us an example of how that might show up.
I mean, I think when thinking specifically about health equity and thinking about how practices can change the disparities that we're seeing, we've seen in the DSM-5, which is the diagnostic manual that we've used historically for diagnosing people with mental health disorders, changes in some of the language, even things like removing like paranoid schizophrenic from the diagnosis of schizophrenia helped change some of that because we knew that labeling specifically was leading to dramatically increased rates of diagnosing Black men and people of color with schizophrenic disorders when they are indeed or not. They might have had some paranoia around the country and the kind of tension that they're seeing. So that's an example of kind of more of like a structural intervention to address some of the issues of bias that we might see in our practices.
It's a really interesting example. Thanks for sharing that.
As we navigate the complexities of the 21st century, what are some key things that parents need to know about raising boys in this rapidly changing world? And how can they and other caring adults support boys in developing these skills and attitudes that they need in order to thrive in their teen years and their years ahead?
Two words that immediately come to mind for me are awareness and education. I think being aware of what's happening, understanding that we are finding ourselves in a real mental health crisis, just nationally and really globally as well. And I think that awareness hopefully makes us privy and in tune to the fact that we need to be better for our teens. Additionally, educating ourselves is really important. We have so much to learn from our teenagers. They know so much and they can really teach us so much. And even us as adults, there's mental health literacy that we didn't have the privilege of having for reasons that are sometimes beyond our control, but even within our control. And it's really on us to take the time to educate ourselves so we can be better for our kids, for our teens. And really the other piece is also demonstrating that vulnerability, demonstrating and modeling that so that teens know that this is appropriate. It's okay to be able to express your feelings with people who you trust and love. And also not being afraid to seek help and knowing that seeking help is not a weakness, it's a strength. Because really at the end of the day, we don't want people to experience crisis before they come to help. The goal is to have people get treatment before it gets too severe.
Absolutely. And that's the only way we're really going to see people thrive, making sure that we're not just intervening at the equivalent of stage 4 cancer, right? We have to do something earlier. We need to get that support up front so that people know how to thrive and are the most resilient versions of themselves. I want to switch gears a little bit and talk about digital health and mental health technology, because as we've seen mental health technologies continue to evolve, it feels to me, and I'm wondering what you think here, it feels very crucial to prioritize health equity and then ensure that all of these tools are accessible and effective for all populations, including people who may face systemic barriers to accessing healthcare and support. I'm wondering what your take is on that. And then also what steps you think that we can take to create a more equitable and inclusive experience and reduce biases, specifically when it comes to digital mental health.
This is a great question. And this is like what makes me so excited to be a part of BeMe. So thinking about digital health and mental health technology specifically, like I was saying before, our systems of care historically left out vulnerable populations, thinking about BIPOC folks, thinking about people who are minoritized along the lines of gender and sexuality. And with digital health really being a new frontier that is now here and developing and growing with respect to how care is delivered, I think it's so important for us to use this as an opportunity to build a foundation that is truly equitable with respect to healthcare. So thinking about what are things that we missed when the previous iteration of healthcare was being developed that left out people so we don't do that again? And what are things and fail-safes we can create when we see that our interventions are not closing the gap quite right? And how are we able to quickly plug those gaps, shorten those gaps, and really address the needs that we have? But I think, again, the steps that are necessary, again, are just really being intentional and thinking about this. It's learning from our previous mistakes and then also using our innovation. It's not just saying that we as doctors have all the answers, but it's understanding that people also have the answers. The people that we treat and care for often know best what they need, and bringing them into the conversation. I think these are things that are going to be really important. It's diversifying our work, the people who we work with. It's diversifying the people who are in the room making ideas. And it's just really being inclusive of really all the experiences that come into play, because there's so many experiences and identities that intersect and create the world that we live in today. And we need to be so mindful of that as we bring in this new frontier of healthcare, which is digital health.
What are some of the key challenges rural communities face in accessing quality healthcare? And how can we address these disparities to promote greater health equity across geographic boundaries?
Yeah, rural communities are so often forgotten and not talked about. Specifically when we're talking about health equity and health disparities, I think with respect to who we're seeing, we often don't talk about rural communities because they often are not in the room. So much about healthcare innovation, a lot of the biggest healthcare centers are usually neighboring or around big urban or suburban areas or affluent areas. And rural communities that are further away are left without. And we know that the amount of providers per person in rural communities is significantly less than the amount of providers per person in an urban area or more affluent suburb. So that is one way that disparities are showing up. And that's then allowing for poor access to care that rural people are facing compared to people in suburban, affluent, or urban areas. I think moreover, and secondary to that, is the fact with these new technologies, it's really important for us to think about how we can use this to better provide access to people in rural communities. Well, there's certainly a lot of policy going on right now with respect to allowing providers from other states or other regions to be able to provide care to other people who may not be in their state. I think right now a lot of it is within neighboring states, but they're thinking about how to expand that beyond that. And that will offer a lot of help, especially as we use digital health, telehealth to be able to reach folks as well. And then the other part is also really being proactive and going into these communities. There's things that as we move into this digital frontier of health that prevent them from being able to have access to it. It's like, how do we provide them the resources to be able to support that too? Is that providing technologies? Is that doing educational seminars, or is that doing workshops to understand what we need to do to use our technologies to help out? And I think those questions need to be asked to really begin to shorten health disparities gap and health equity gap that we're seeing for rural populations specifically.
I know you kind of just talked on this, but how can we leverage technology and innovative solutions to bridge the gap between, these rural and urban areas and when it comes to healthcare?
I think, again, telehealth is really a big innovation for us. Being able to provide healthcare and having data that shows that telehealth care and in-person healthcare have equal outcomes is really huge, because that tells us that we can do a lot. So the barrier in which there's not enough providers in the area, we can actually begin to address that by having people who are further away but still have access to internet and telehealth care to be able to get the care that they need. And I think that's really going to be one of the big things that we do with respect to our technology. I think with respect to the digital platforms, it's thinking about what kind of content, what kind of materials will better speak to populations from rural communities. And again, it's going to be really including them in the conversations. We often turn towards the urban center or the affluent suburb when we want to ask questions or we want to have focus groups. So we really also need to be able to bring in people from rural communities so they can also have a very valid input in shaping the future of our healthcare delivery.
Taiwo, I'm wondering if you can share a little bit more about your work and how you're working to address mental health and health equity issues, especially for boys and for teens from BIPOC communities and also rural communities, like you just mentioned.
Being a part of BeMe is really exciting because the future is happening right now. The future we've talked about for several years and decades is happening now. And we have a really special opportunity to begin to shape that in a positive direction for communities that have been left out of the conversation, like I was saying before. The work that I'm doing at BeMe, working with Neha as a clinical innovation fellow, is thinking a lot about what our app is producing in terms of content, in terms of the product, in terms of looking at our outcomes, working with our teen advisory board and talking to teens directly from these marginalized communities to think about what that might need, and really being able to see that then translated into what the app is actually doing. And I think that's truly a special thing. It's me bringing in some of my public health perspective and expertise, and also looking at what works in the market, what works in care settings, and how can that be translated into a digital platform and for BIPOC communities and for rural communities, and thinking about the work for boys particularly as well.
How is BeMe using its platform to support and empower these teen populations? And what are the biggest opportunities and challenges in this space moving forward?
BeMe truly is very different than what I've seen. I've been able to take a really good look at a lot of other digital mental health applications and resources. And I think what BeMe is doing that's very different is that it's really involving teens. I think I come in with a wealth of knowledge and experiences, both clinically, public health wise, knowing research and literature. But the things that have been, I think, the most helpful to my contributions has been working with the Teen Advisory Board, talking with teens nearly weekly just to figure out what is going on, hearing from them, teens being so vulnerable and open about their experiences and things that they need to see. And I think that having such a big impact on what the app actually does is huge. And I don't think that's really happening anywhere else. I think the biggest opportunities we have, again, given that we're in this new frontier of healthcare delivery, is that we can now really begin to think about and become a standard of care for how we serve populations equitably, how we serve this country equitably, how we think about vulnerable populations that have been left out of the conversation before, and how to make sure that they are in the conversation as we build up an application or a resource that's going to help teenagers. But I think the biggest challenges we face are these big disparities that exist currently, the current health equity gap that we're facing. That's a huge challenge. I feel so encouraged by the BeMe team because they welcome the challenge and are up for it.
Yeah, I love that you highlighted the Teen Advisory Board, because I feel like elevating teen voices and learning directly from teens is the only way that we're actually going to build something, again, that's inclusive and equitable and that creates a sense of belonging for everybody. I'm curious, Taiwo, what have you learned from them, and how do you feel like those learnings help BeMe really remain teen-centric?
I think part of the reason why I've always wanted to work with kids, I wanted to be a pediatrician. Even when I was thinking about surgery, I wanted to be a pediatric surgeon of sorts. And now, aspiring child psychiatrist and adolescent psychiatrist, is because I really believe teens have so much to teach us and we have so much to learn from them. I remember as a teen often feeling like, because I was a teenager, adults didn't want to listen to what I was saying. I was so fortunate to grow up in a home that really allowed me to have a voice and really allowed me to be able to have conversations. And I think, moreover, working with teens today, we can learn so much from them. And I've just been able to see that over and over, time after time again, with the Teen Advisory Board at BeMe. The teens are so intelligent, so smart, so insightful. They're not afraid to give us the hard criticism if we have an idea that's not looking too hot, or something's going on our social media page they don't really like, they'll tell us. And I think that feedback is important because it lets us make sure that we develop an app that works for them and it's by them. And I think that's been really special. I think some of the main insights are just thinking about, particularly as it relates to some of the populations I've specifically been focusing on, like the BIPOC youth, is just thinking about what kind of things are needed, understanding that they don't want to be pandered to and say that, oh, we want something that speaks only to our kind of racial or ethnic identity. We also appreciate the general content. We also want the opportunity to know that there's specific things that we might be experiencing and how to get the tools and skills to handle those things. And I think they've done that so beautifully and modeled that so beautifully, and it really inspired me a lot.
That's so important. I'm wondering also, I know you did a focus group with some of the male identifying youth in the Teen Advisory Board. I'm wondering what you learned from them too.
I mean, so much of the conversation that we're having today was reflected in that focus group. And again, it was really warming to me to see boys and male presenting folks who were able to really articulate their emotions, who were able to talk about how they were raised in homes where they were told to be macho or to demonstrate machismo or things of that nature, but be able to come speak to their parents about that, and that their parents are able to receive that and change and learn with them. And then even one of our teens talked about how their home was still not quite receptive to them as it relates to feelings or expressing emotions or even some parts of their identity. but being able to find spaces in their community, at their schools, with their friends, and even with mental health providers and professionals. I think that was really special. And on top of that, them really wanting to see more and more content around that, specifically as it relates to boys and male presenting people, so that they can understand how to do this. Because the BeMe teens, the Teen Advisory Board, they obviously represent a subset of teens who might have a little bit more access to understanding mental health in ways that some teens might not have. And in spaces that I've worked in New Haven in New York, I've seen that. In my clinical settings, I've seen that. And they were able to help us think about ways that we can help educate folks who might not be as far ahead in being able to talk about their feelings, so that they can begin to have access to their feelings, acknowledge that, and know what to do with them and where to go with them. And I think was one of the bigger insights that we were able to get from that male teen advisory group meeting.
What a wealth of information. Taiwo, we're so happy and grateful to have you on the team. We're even more grateful for our teen advisors, and we're most grateful for the teens who are listening today. So before we go, Taiwo, what advice would you like to leave our teen listeners today?
The main piece of advice that I want to leave teens is, every storm really does run out of rain, and the sun will always rise again. And I know that sounds a little corny, but I think it's really important just to understand that your feelings are okay. It's completely okay to be you. There are people out there who care so much about you, and maybe you haven't met them yet, and they're out there. But, if anything, there's always mental health providers that could offer support. There's increasingly more and more groups that are speaking to the specific needs of specific populations and being able to seek them. And we're here for you. We're proud of you, and we're excited for the future that you all are creating.
Thanks again, Dr. Alonge. It was so great to hear about your work to help put a spotlight on health equity. And we're so happy that you're helping BeMe create a platform that's inclusive and equitable for all teens.
Until next time, this is Dr. Neha Chaudhary, my co-host Hazuri Dhillon, and our podcast producer, Derek Baird, reminding you to keep being you.